Great to meet you. I'm gonna disappear off the video, and I probably won't reappear again. But I'm glad I got to talk to you before we started.
Same here, James.
Okay, I'm gonna just start with announcements. So greetings everyone, my name is Rachel Hasna and I am with the University of New Mexico's Division for Community Behavioral Health. Welcome to our Law and Mental Health Didactic Series. A couple of housekeeping announcements. The CEU link will be loaded in the chat, copy and paste or click on it, fill out the eval. A certificate of completion is automatically generated, so please save a copy of your responsibility. If you're on your smart device, you'll just take a screenshot of the document. If you're on your computer, you'll save it as a Word doc or a PDF, whatever works for you. If you're joining us by phone and you need that link, just send me an email and I'll be happy to get that to you. We will be sharing the slides as well as the recording link by the end of this week. And if you have any questions, you can just submit them in the Q&A. And I'll hand it over to Julie.
Thank you, Rachel. Welcome everybody to the University of New Mexico Law and Mental Health Didactic Series. This series is hosted by the University of New Mexico Department of Psychiatry and Behavioral Sciences and the New Mexico Behavioral Health Services Division. We're glad to have you join us here today. My name is Julie Bravko. I'm an assistant clinical professor in the Department of Psychiatry and Behavioral Sciences. First, I want to announce that we are accepting applications for our forensic postdoctoral fellowship. We have 2 spots available for the 2021-2022 year. Our brochure is ready to go. Applications are due on January 14th, and I'm so excited to let you all know that we were just approved for the 5-year time waiver. So email me if you want a copy of that brochure. Otherwise, send us in those applications. Next, I want to remind you to join us next week. At that time, David Murad is going to be presenting an integrative model for conducting mental state at time of the offense evaluations. Now, for our talk today, we'll be holding questions until the end. Please ask them in the Q&A anytime you feel comfortable, but just know we're not going to get to them until the end of the talk. Also, we always try our best to get to as many of your questions as possible. So please forgive us if we can't get to yours. We are doing our best. Next, for those of you who want CEUs, but you're on a tight schedule, just know you have to stay for that full hour, but you don't have to stay longer than that. I'll try to let you know when that hour has passed, but we will likely be staying on longer to address questions. So now it's time for what we've all been waiting for. I'd like to introduce to you our speaker for today, Dr. Terry Kukor. Terry did ask that we keep his introduction brief. Details from his bio are in the presentation materials. Now, the reason we invited him here today is because of his knowledge and vast contribution to our field. I also heard that he was a really nice guy, and I wanted to see if it was true. Terry also wanted us to mention to you that after almost 30 years of doing forensic evaluation, he's made most of the mistakes that can be made, and he's tried to learn something from each of them each and every time. He's developed a passion for critical thinking as one of the best remedies for preventing mistakes and minimizing errors. And that's what he's going to be talking to you about today. Dr. Kukor, on behalf of the University of New Mexico Department of Psychiatry and Behavioral Sciences and New Mexico's Behavioral Health Services Division, I'd like to welcome you and thank you for presenting today. We're grateful for your time and expertise, and I'm now going to turn it over to you.
Thank you very much, Julie. And I really do appreciate you being mercifully brief on the introduction. I asked Julie to be brief because I have this quirky view that nobody comes to a talk or a workshop to hear the speaker introduced. So if you want to know some things about me, there's a brief bio that's right here that I'm going to skip over. I've got no financial disclosures to make as part of this program. And anything that I have to say doesn't necessarily represent the views, the policies, the positions of the University of New Mexico that I will be speaking for myself today. And before we dive in, let me just say, I'm really glad to be spending some time with all of you today. So let's jump in. Here are the learning objectives. I'm going to be talking about 5 different domains of errors that sometimes crop up in forensic evaluation. I'm going to be identifying a variety of sources of authority that can help us navigate these problems, and you should be able to identify those as well by the time we are done. And then I'll be going over some specific remedies for each of the errors that I'm going to be highlighting today. Now, I'm not just going to be talking about getting it wrong. That would be lopsided, wouldn't it? I would like to talk just a bit about some resources for getting it right. And these are 3 of the better ones that I know. I recommend all of these resources to you. They're all articles, some more recent than others. But if it's important to you to get it right and navigate successfully around the many pitfalls and errors that are out there that we can make, these are 3 excellent resources, and I recommend each of them very highly to you. Now, here are the categories of errors that we will be talking about today. Errors weighing evidence, errors in roles, errors in the reasoning process and forensic evaluation, errors in report writing, and errors in our approach to the evaluation. I've been collecting this list for many, many years. My guess is that if we did a poll right now, and I asked a question, how many of you have a list on your phone, your laptop, your desktop, your tablet, maybe even written on a piece of paper someplace? Probably most all of us would say we do. I certainly do. We keep lists for reasons. It feels great to cross something off on your to-do list, but I believe that list making helps us stay on track and stay focused on the things that are most important to us. Now, within each one of these domains or categories of errors, we'll be talking about only 1 or 2 problems, even though there are multiple problems, as I'll show you in just a moment, for each domain. Given that we only have an hour today, I had to make some difficult decisions about what we would have time to cover and what we simply do not have time to go over. So let's jump into errors weighing evidence. And here are the list of errors. All of these things, in my opinion, would really be worthy of extended discussion, but I'm going to focus primarily on item number 1 and item number 2. I'm assuming that there may be some people that work with me or know me in this webinar today. And for those of you that do, this is not going to surprise you that I want to spend some time talking about bias and talking about critical thinking. These are things that matter a lot to me. I really wish we had time to go over some of these others. I'll make a couple comments on them. In terms of disrespecting case complexity, Albert Einstein reportedly said one time, things should be as simple as possible, not simpler. So we want to avoid oversimplifying things in the interest of making something digestible. Number 5, we could spend a full day talking about that issue. And there's actually quite a bit of overlap, I think, between failure to regard cultural or racial issues and bias and stereotyping. And number 8, I just want to mention real briefly that A concrete way that I have found this useful, I only do, or not only, but I primarily do criminal forensic evaluation. And when I'm doing a competency evaluation, if I'm opining that somebody doesn't meet the criteria to be considered competent, in Ohio, where I practice, we're required to submit an opinion about restorability. And this is one of the lessons that I've learned over the years, is how important it is to take into account somebody's clinical history, not because I've got a lengthy clinical history section in my reports. I do not. But what I do think is important to know is if somebody is on a downward gradient, they've got a mental disorder like schizophrenia, and they're getting worse over time. Maybe if they were restored to competency 8 years ago, they might not be beginning at the same point clinically today as they were back then if their symptoms have become more acute. And that's all I want to say about the rest of this list. So let's take a closer look at number 1 and number 2. There's lots of good definitions of bias, and all the ones that you see here, I think, are perfectly fine. I think the definitions that I tend to favor all involve bias as something that obscures our ability to objectively see or know something. The reference at the bottom of the slide to the lens is something that I think a lot about. I think this is a very useful way to think about bias. It's a lens that we look through, and it distorts what we see. Now, this occurred to me when I was putting this presentation together, that we have a lot of lenses in our life, don't we? Sometimes they're glasses that we wear, and if you're like me, you probably don't clean your glasses frequently enough. They get dirty, they get scratched. Sometimes just looking at them seems to endow them with fingerprints. But if we spend as much time as we ought to cleaning these lenses, we ought to pay just as much time paying attention to the cognitive lenses, if you will, that we use when we are understanding the world around us. Those get scratched, those get marred. They can prevent us from seeing clearly what might be right in front of us. Now, there are many biases that, cognitive biases that can represent a threat to objectivity in forensic evaluation. Again, we don't have time to go over all of them. I'm going to hit a couple highlights here. We'll start with anchoring bias. Anchoring bias refers to what it is that you notice first about somebody that you are evaluating, that those initial impressions often form an anchor of sorts, and we tend to build other impressions and form opinions and conclusions and draw inferences that are often consistent with that initial impression. Diagnostic momentum is something that I think we tend to see more when we are reviewing records. It's the tendency to assume that the longer a diagnosis has been present in somebody's documented history, the more likely it is to be true. I've heard this referred to as chart rumor. I like to think about it as chart gossip. Maybe it's true, maybe it isn't, but we ought to be making our own independent efforts to verify diagnoses that we see in records. I think if Sir Isaac Newton were alive today and were a forensic psychologist, he just might say something that a diagnosis in motion tends to stay in motion. And that's what we mean by diagnostic momentum. Sunk cost refers to the tendency over time that the more we put into forming an opinion or writing a report, the more reluctant we can become over time to consider data that are at odds with the direction that we're going in a report. Confirmation bias, and if you're going to remember one thing from today, I would encourage you to remember this. In my view, it's the single biggest threat to objectivity in most any forensic evaluation. And I think it boils down to a single question. Confirmation bias works because we end up seeing what we expect to see or what we expect to find. So the question then is, what am I expecting to see? It actually yokes pretty nicely to anchoring bias, because if we focus our findings on what we're noticing first, that can really set the stage for confirmation bias. So what do we do about bias? Well, there are a couple of general recommendations about bias in ourselves. First and foremost, and this is really important, simply being passively aware of bias and the role it plays in any judgment that we form is not going to cut it. It's not sufficient. Hopefully, many people on this webinar today have gotten flu shots. You show up, you roll up your sleeve, and you don't have to do much more than those two things, and you're inoculated. Bias does not work that way. Bias and debiasing techniques are effective only to the extent that we are actively challenging beliefs, opinions, and inferences, and considering alternative constructions for them. There is no flu shot for bias, and you'd be building a false sense of security for yourself if you came to the conclusion that because you listened to me talking about this today, that you thought, I got it, I'm covered, I heard Kukor talk about this, I'm good. No, you're not. None of us are. There's no value to passively engaging with this material simply by being aware of it. Now, what does work, and I think this is shown to be true time and time again in the literature, is that if we are actively engaged with our data, questioning why our conclusions may be wrong or what else might account for the opinions we are forming or inferences we are drawing. Here's this great quote by Aristotle that I would recommend as a forensic model. It's the mark of an educated mind to be able to entertain a thought without accepting it. The takeaway here is we spend so much of our time, whether you're doing criminal or civil forensic work, thinking about our data. I'm going to encourage you today, we have to do that, but we also must think about how we are thinking about the data. So if we're spending a lot of time worrying about data and thinking about what all those data points mean, we should also be spending time thinking about our thinking about the data. Bias and collaterals, what do we do with that? Well, you count on it. My very favorite question to ask when I am reviewing or contacting a collateral is to ask, what do you think should happen in this case? If that person is positively or negatively disposed towards the evaluee in question, I'm probably going to get a response to that question. And to borrow, maybe steal a phrase or misquote a phrase from Stephen King, who said, the road to hell is paved with adverbs. I'm going to say that the road to forensic hell is paved with adjectives and adverbs. Why is that? Because I believe that particularly when we're talking to collaterals, that's where visceral bias hides, is in the adjectives and adverbs. For a long time now, I've been engaged in a process of trying to minimize how much I indulge adjectives and adverbs in my reports for the exact same reason. Kirk Halbrin, and there's the full references at the end of the PowerPoint, has some really marvelous, very useful practical guides for dealing with bias in collateral. He's got a couple really good suggestions here. I think rather than spend time talking about even a few of them, if you haven't read these articles, I strongly recommend them to you. So let's talk now about what we do about specific biases. If there is any concern at all that you may have an anchoring bias, you should be able to identify what is it that I noticed first about this person. And then try and, as you are constructing your formulation of the case, begin a review of the data in different places. If you're reviewing a case with more than one colleague, with one you might start with collateral, with a second you might start with psychological testing or a forensic assessment instrument. The idea is you move the starting point so that you are introducing some degree of randomization to what people hear first, and to minimize the impact of the anchoring bias. For diagnostic momentum, I think it's important to exercise skepticism. Skepticism doesn't mean that you are suspicious in a crusty way. It means you can be convinced, but you bring some doubt to the table. And you want to see what is the evidence for this particular diagnosis. I lived for many years in the great state of Missouri, where the unofficial state motto, you'll see at the very bottom of the slide, show me. It's another wonderful forensic motto. You want to make up your own mind, I think, is important about diagnoses to prevent yourself from falling in that trap of diagnostic momentum. Sunk costs. Again, the more time you put into something, the less likely you are to consider or evaluate data that are divergent from whatever your leaning is. One of the things that's really useful, and we like to do this at Netcare in Columbus when we are having somebody present a case, establish a devil's advocate whose sole task is to first identify and then argue for other plausible, possible ways to explain things. If you don't have a group that you can do that with, that may have to be a hat that you put on for yourself, so that you are now stopping thinking this way and beginning to think, let me try and challenge that. What might be some other possible ways to explain what I think I have in front of me in terms of the case data? Confirmation bias, and again, this is one that I think is fairly insidious and fairly universal. Identify data that would be inconsistent with your initial hypothesis and be on the lookout for it. Another way to think about this is to look at two opposite sides of the same coin. If your initial hypothesis were true or correct, what would you expect to see supporting that? And then, do you in fact have such data? The flip side of that coin, if your initial hypothesis were incorrect, what data would you expect to find? And then you carefully examine your data field for any instances of disconfirmatory data. What do we do about not thinking critically? Well, this one's kind of obvious. Think critically. Now, I'm going to give you in the next 60 seconds the shortest course on critical thinking I hope that you've ever had. This topic deserves a lot more attention, but I'll say a couple takeaway points. Critical thinking is fundamentally about asking questions. The engine of critical thinking is bringing very aggressive questioning to multiple elements in the formulation that we're putting together. And I think the foremost useful things to question when we are trying to examine our own data under the bright light of critical thinking is, one, identify and question your assumptions. Two, question the evidence that you have. In other words, how is it that you think you know something or believe something to be true? What is the data that support that? And might they support any other conclusions? Identify your perspective and examine the data from a different point of view. And a mnemonic that I like to use for this, there's that old trope of orientation in a mental status exam. The person was oriented to person, place, and time. Use those same three things for perspective. So for person, identify somebody that usually disagrees with you or sees things differently. Maybe they've got their malingering threshold set higher or lower than you do. There's great value in discussing things with somebody that doesn't see things the same way from you. And if you don't have that as an option, then you'll have to conjure up an introject of that person and ask yourself, how would so-and-so see this? And start to look at something from a different point of view. In terms of place, I'm going to come back to that on the next slide that I think will have a good illustration of that. But time, if you imagine a point in the future where you have submitted a report and you find out that a judge or a jury has just completely come to the opposite conclusion that you have, ask yourself, in hindsight, what might have accounted for that? What in the field of data that I had available might have accounted for it? Or are there any unknown things that might have accounted for this that I just didn't even know about? This is useful because it gets you out of that point of view that we are often wedded to when we are looking at our own data. And then lastly, you question your conclusion. And we just talked about two ways to do this. If I were right, what would I expect? If I were wrong, what would I expect? And then concretely, consider the opposite. Now, I'm going to apologize for putting this graphic up here. I hate these things. They give me headaches. They make me dizzy every time I look at them. But when I look at this picture, I'm going to try not to look at the object these two people are looking at. But I ask myself, who's right? And I think the answer is they both are. What you see depends upon where you stand. So find psychologically another way to stand someplace else from where you are currently looking at the data. And, again, one of those ways might be to look at it if this is going to be a contested case. How might the other expert be approaching this evaluation? That's an idea I stole from Randy Otto, and it's a very useful way, again, to expand the field of data that you're considering. Remember as you do this that not only does what you see depend upon where you stand, but just because you're right doesn't necessarily mean I'm wrong. All right, I'm going to move next to errors in roles. There are multiple ways that we can get into trouble with roles. I'm going to focus primarily on number 1 and 2 here, but I'd be remiss If I didn't say, if you're not familiar with the dynamite work that Dan Murray and his colleagues have done on allegiance bias, you really ought to read some of that material. I know Dan presented in this for New Mexico not very long ago. And if you're doing work hired by one side or the other, take a look. Roles, the one I want to focus on that sometimes gets us into trouble is the difference between experts and consultants. Experts, we evaluate somebody, we write a report, we testify if necessary. We should be guided by the values of objectivity in our work, and we should strive to be indifferent to the outcome. It's very different than the role that a consultant plays, who almost certainly is not going to be evaluating and examining. But a consultant is going to be hired by one side or the other to try and identify the flaws and vulnerabilities in expert one's report. If I'm hired privately, one of my tasks might be to write cross-examination questions focused on what I think are the vulnerabilities in that report. I'm not objective in that sense. I'm not neutral in the sense I'm on one side here. I believe when I've tried to run down where does this distinction come from, I believe that it comes from the federal rules of civil procedure, which makes a distinction between testifying and non-testifying experts. And as my friend Dave DiMatteo likes to say, he starts there and then extrapolates to criminal forensic evaluation. And that's one of the reasons why we see this distinction between expert and consultants. Now, here's an excellent source of authority, the specialty guidelines for forensic psychology, in terms of what they have to say about integrity in multiple relationships, our ethical principles for those of you who are psychologists. 3.05 also is all about multiple relationships. This is something that is sometimes misunderstood. Multiple relationships become an ethical problem to the extent that they impair one's objectivity. And in my point of view, if you are trying to play both roles simultaneously of both expert and consultant, you may be running into an ethical problem. It's not very likely to begin as a consultant and then be pulled into the role of expert. I think it's much more likely to begin as an expert and then be pulled into a consultant's role. Why is that? Well, I think a lot of attorneys might think about it. Look, Doc, you're already there. You know the case. Why should I spend more money to hire a consultant? And then there's simplicity. You're familiar with the data. It's just going to slow us down and take more time to hire somebody else. Now, this next statement may be an overstatement. As I've thought more about this, maybe a better way to say it is, at least for me, it raises ethical questions about being in that same role of consultant and expert at the same time. So let's look at a couple examples. If our guiding principle for these examples is what's going to help the finder of fact, am I working to clarify and educate the fact finder, or is it my intention to win? Let's look at some examples. You get asked on the stand, what does this term in Dr. X's report mean? Is that okay? Yeah, probably. When it assumes, of course, that you know what a term means. So if it's jargon like circumstantiality, sure, you can probably answer that. I saw not too long ago in a report a reference to anti-gravitational strength. I have no idea what that means, and I wouldn't be able to answer it. I think I'd kind of like some of that, whatever it is, because it sounds good, but I wouldn't be able to explain what that means. What about this question? Why would Dr. X give this test? Well, it's okay if you stick with why. I mean, you might have to start by saying, well, I don't know, but I can explain why I did or did not use that test. Third, is this test ordinarily used in sanity evaluations? Yeah, that's probably fair. Maybe it's something easy like a projective test that isn't used very routinely. It is used sometimes, but not very routinely in sanity evaluations. Then there's this question, well, can you suggest a line of cross-examination? Maybe you're meeting going over with the side whose your report favored, and you get asked this question. I'm going to say, nope, I think that crosses the line. My advice on this matter is to stay focused on your own opinion and don't get pulled into explaining why the other expert is wrong. In my view, that's not why we're there as an expert. We're there to advocate for what we think our data represent. So what do we do about these errors and roles? I think it's important to know your lane and stay in it. It's important to clarify what role you're going to be in up front. Don't switch roles if you can avoid doing so. I would also say that if you are hired by one side or the other, rather than essentially working for the court, which is principally what I do, very important, as I mentioned, to be aware of the subtle but very strong gravitational pull of allegiance bias. And the best remedy that I can suggest for that are the devil's advocate, where you're looking for other possible explanations that might explain the data. Okay, that brings us to errors in reasoning. And let's take a look at what's on the list here. Again, all of these are worthy of a fair amount of time. We don't have a lot of time, so I'm going to focus primarily for the next few minutes on number 7 and number 8. The fundamental attribution error, for those of you that maybe it's been a while since you've taken social psychology, the fundamental attribution error works like this. When we are explaining bad or unwanted behavior in other people, we tend to overemphasize internal or trait-based explanations. But when we are explaining our own bad behavior, we tend to overrepresent situational constructs. But when we are looking at our own successes, we tend to overemphasize dispositional or trait factors. So, yeah, Dr. So-and-so did poorly on cross-examination because he doesn't take his work seriously. That would be a trait-based explanation. When I'm turning that light on myself, well, I did poorly on cross-examination because a car alarm went off last night and it kept me up and I didn't get enough sleep. Or conversely, you know, I nailed this because I'm really smart. Those would both, all three of those would be examples of the fundamental attribution error. Let's take an example. You're doing an evaluation, excuse me, and you notice that somebody exhibits rather notable levels of irritability, and you develop some hypotheses to explain this. Now, hypothesis number 1, the examinee is irritable. Number 2, this is stemming and flowing from this person's bipolar disorder. Number 3, the person is unhappy and irritable about having to undergo the evaluation. Number 4 is you've done something irritable and the person is simply, or irritating rather, and the person is responding with irritation to you. Number 5 would be you're caffeine deprived, crabby, and projecting your own irritability onto this person. And 6, some combination of the above. The point here is that there are often more than there's more than one explanation for something, and particularly if you are if your opinion is dependent upon trait-based explanations, slow down and ask yourself, are there any situational determinants that I may have overlooked or not given enough weight to? And one of the easy classic ways to do that is walk a mile in their shoes. Ask yourselves, if I was in this examinee situation and I was thinking the way they are and I felt the way they are and I had the same perceptions and constructions of the world around me, how might I behave? That might help pry you out of that tendency to overemphasize trait-based explanations. Now that brings me to heuristics. This is Daniel Kahneman. To my knowledge, he is the only psychologist that has won a Nobel Prize, and wrote one of the most influential books that I can identify in my professional life, Thinking Fast and Slow. And let's take a look at it. Basically, he says we think in two different ways. We've got this very fast, intuitive, automatic way, and it saves us time, and it's what allows us to multitask. For those of you that are still driving anywhere during the pandemic, it's what allows you to do things like get to your destination without having to stop and think, oh, I got to hit the gas now. I better start tapping the brakes now. We tend to do these things automatically while we're thinking about or doing something else. System 2 thinking, on the other hand, is much slower, more deliberate thinking. It's the kind of thinking that we ought to be using when we are working on a forensic evaluation. System 1 thinking is prone to problems associated with a heuristic, which is a cognitive shortcut. Kahneman identified several of them, and the one that I think is very likely to show up in the context of a forensic evaluation is the representativeness heuristic. This is happening when, if you hear yourself saying or thinking, you know, I've seen this a lot of times before. This person is just like that person I saw a couple weeks ago, very similar dynamics. That may be a heuristic at work. I'm not saying that the similarities are wrong, but what happens with this heuristic is we tend to overemphasize the similarities and de-emphasize the ways in which these two people might be different. What do we do about heuristics? Again, do yourself a favor, get this book and read it. It's got a lot of very, I think, practical applications to the work that we do. I encourage you, if you're often in a hurry, and I certainly feel that way, many of us are in our professional roles, find some ways to slow down. Look for those micro creases in your day that might allow you to think with system 2 thinking, to slow down, to downshift cognitively. Maybe you take the stairs rather than the elevator. Maybe you park at the end of the parking lot rather than right next to the building, and use some of that time to think. One of the ways that you can use that time is to actively seek out alternative explanations for what you think you know about a case. If you adopt the position of somebody that's questioning or even attacking your opinion, that enables you to see your data as that person might be seeing it. And that directly contradicts one of these heuristic funnels that we get in, where the data set is narrowed. You want to do the opposite and expand. Okay, let's move up to errors in report writing. I'm not going to cover any of the ones on this slide. I will say that for number one, that these are my two favorite books on forensic report writing. They're both terrific. And again, I wish we had time to go over some of these things. I want to focus explicitly on number 9 and number 10 here about how we deal with missing data points and inconsistencies in the data that we have. One of the ideas is qualifying our conclusions. When should we do that? Well, I think it's worth considering when you've got a linchpin data point. Maybe it's something that a key inference rests upon. If it's got more than one plausible explanation, maybe you ought to think about what's on the other side of that and give that some thought and spend some time writing about that in your report. I think it's useful to qualify data when you've got significant gaps in the data, maybe some key collateral information that you've written for, got a release for, and your report's due, and you've got to make that decision. Do I have enough to go forward with? But you might want to note that. Maybe some psychological testing data is obsolete. And particularly in this era of COVID, for those of you that are doing video conference forensic evaluations, we have some newer limitations on how we can administer forensic assessment instruments or psychological testing. But sometimes data supports delimiters. In other words, are there some conditions under which my conclusions are more or less likely to be true? The best example that I can think of is violence risk. Sometimes that is exquisitely sensitive to situational context. That might be a way you delimit your data. When you've got inconsistencies in data, I try and do two things. Real simply, I describe what they are, and then number two, I explain them. Here's an example from a report that I wrote recently where I'm identifying how come this person with a diagnosis of bipolar disorder didn't exhibit those things or acknowledge those things in the mental status or in my behavioral observations. I feel obliged to explain that in some ways and provide for the fact finder how I best make sense of that level of inconsistency. For discrepant data, the data that may not support your opinion, it's kind of funny. Over the course of my career, I used to be nervous about being asked about these things. Now I feel nervous if I haven't identified them. Now I go out of my way to identify things that may not support my data. And the structural remedy that I note on this slide is the very last section of my competency to stand trial reports is titled something like data that may not support or be consistent with my opinion. Sometimes there's a lot of data that falls in that bin. Sometimes there's almost none. But I feel much better about bringing rigorous scientific inquiry that's objective to the table when I have identified these data points and explained why I don't find them persuasive. Errors in approach. Lots of errors that we can make in approach. I'd say for number 8 and number 9, it's a pretty humbling read, but take a look at Malcolm Gladwell's 2019 book on talking to strangers. He punctures a lot of holes in the idea that we are good at reading people and goes through some of the evidence that indicates maybe we're not as good as we think we are. But I want to focus primarily on number 7. And this is mostly for those of you that may be newer to forensic or are transitioning from a clinical to a forensic context. I've seen this many times with people that might have a lot of experience clinically and want to move into forensic work. Hard to believe that this article by Greenberg and Schulman is now as old as it is. This is the irreconcilable conflict between therapeutic and forensic roles article. It was updated in 2007 with the very dramatic title, When Worlds Collide. Both of those are in Professional Psychology Research and Practice. The references you'll find at the back of the PowerPoint. We don't have time to go over all of these. Suffice to say that there are some very divergent sets of values that are brought to the table when you are in a clinical versus a forensic one. One of the ones that I want to highlight is the second one, the cognitive set. Of course, somebody ought to be empathic when you are involved in a treatment role, when you're in a clinical role. And we can't afford that, I think, to be that single-mindedly empathic. Why? When we're in a forensic role? Because sometimes the individual is trying to present themselves in a less than candid way. Maybe they're exaggerating, maybe they're defensive, but we want to be skeptical. There was some really interesting article published on this in 2018 in Law and Human Behavior, coming out of Sam Houston, I think, on the role that empathy plays and how far do we go with empathic comments or nonverbal behavior in a forensic evaluation. Well worth considering. So what do we do if you are transitioning from a from a clinical to a forensic role? First of all, you should certainly be familiar with Fry and Dalbert that established the admissibility standards for scientific evidence. And simply because something is interesting or you found even useful in a clinical context, depending upon how you came to that knowledge, it may or may not be admissible in a forensic context. This article by Faust, 2018, Admissibility of Behavioral Science Evidence in the Courtroom, the translation of legal to scientific concepts and back again, is really useful, and I recommend it highly for those of you that may be struggling or just want to know more about making this transition. Faust explores a lot of very practical ways to think about this kind of transition. Key in this is really moving from that empathic into that skeptical role where you are a scientist testing hypotheses against the data that you evaluate and then representing that data to the court. That is a very different cognitive and emotional value-laden set that you engage in when you are in a forensic role. Now, as I wrap up, we've got about 10 minutes left. Back in 1969, Jay Haley, and I believe he was at the Philadelphia Child Guidance Clinic, wrote this very tongue-in-cheek essay that has long been one of my favorites, The Art of Being a Failure as a Therapist. And it was his sarcastic attempt to be very prescriptive about what we might do if you want to make sure to fail as a therapist. And I've adopted these are my ideas for if you want to fail as a forensic examiner. Number one, Trust yourself unconditionally. Believe every single thing you think. Number 2, question nothing, certainly not your assumptions. Number 3, attribute traits boldly. Context just muddies the water. Number 4, logic is for computers. Blindly follow your gut. The faster, the better. Number 5, be passive in your approach to supposed bias. Number 6, neutrality is for robots. Care deeply about the outcome of your forensic evaluations. Number 7, role boundaries are for the small and the meek. Be big and cross lanes boldly. And number 8, don't be distracted by Daubert. Forensic evaluation is more art than science. Let your inner Mozart shine. Now, this is being recorded, and 30 years from now, I hope when somebody is looking at this, they hear me say, I'm being sarcastic about all of these points. These are all the exact opposite of what you should do if you want to succeed. But what I've tried to do in the next slide is to distill the essence of the things that I've talked about today in terms of if you want to be a success as a forensic examiner. And I can distill this whole past hour down to 10 words. Develop and practice the habit of thinking about your thinking. Don't just think about your data. Think about how you are thinking about the data, and you just might be setting yourself up for success. We've got about 10 minutes left. I'd be happy to take whatever questions you might have.
Thank you so much. Really appreciate that. And I'm pretty sure I've failed a number of times too after listening to your talk. The first question is, since there's little question that allegiance bias occurs with both consultants and testifying experts, why are we making an issue about role conflict? By making this differential and expanding upon role conflict issues, are we not pricing ourselves out of the market because so many other professions are more than willing to do both jobs? And in addition, does the requirement, which the person that's asking the question says they dispute, that you hire 2 people, make the retention of experts impossible for people who have limited means?
Well, we all have to make our own decisions about what we think is ethically defensible. I have enough concerns about this issue that I would not put myself in that situation. And if somebody's going to ask me, I'm going to say at very least, I think it's ethically questionable. My experience is that people get it when I explain this. Attorneys get it. They might not like it, but they get it. And we have found that there's nothing wrong with being an expert on one case and a consultant on a separate case. And in fact, we offer both services.
Okay. So I'm getting a lot of questions. I'll try to combine them about how do we talk to the court, or how do we talk to attorneys about this, both when we're hired and then also when we're on the stand and we're asked about it on the stand by a judge or an attorney trying to put us in a position where there might be a role conflict.
Well, that's tricky. I think with a referring attorney, it's wise to make a discussion about what's under the umbrella in the role boundary and what's not, before you agree to take the case, and make sure that there's some shared understanding about that. With a judge, many of us have probably been in situations where we didn't think that we should answer a question, but a judge just leans right over, points a finger at you, and asks you a pointed question. Well, you've got to make a decision in that moment. Is this worth me sitting in jail overnight for because I've been found in contempt of court? And again, That's a decision we all have to make privately, but I think the best you can do is to try and explain it simply to the court. But if pressed by the court, then you've got that difficult decision that you've got to make. Is this worth whatever the consequences might be if I stick to my guns on this?
Thank you. Next, can you talk about confirmation bias in assessing for feigning? Do you think that doing testing regarding feigning could be an example of confirmation bias? Could it be argued that we're seeking confirmatory evidence by doing so?
Well, I'll tell you I'll give you a concrete example. It's a great question. And yes, I think we always have to be alert for this. I noticed that sometimes when I give a SIRS, that there are some items that are, if I'm not entirely certain in the moment about how to score it, I think I'm just going to move on. I don't need to score this right now. I'll come back and score it later. And then when I'm all done, I start computing the scale scores in the order in which the subscales are listed on the title page. And I found that I got worried when if I knew that two scale scores were in the definite range, and then I got to an ambiguous item, I didn't want that knowledge to influence my scoring. I think the best way I can think to put it is this: anytime we are forming judgments on data in which there's some subjectivity involved, and let's face it, that's most of the time, we're opening the door for bias. So what I decided to do is I now have a habit of going through the entire SIRS and scoring every single item before I start calculating those scale scores. Does that matter? I don't know. I think it might, but I think it's a concrete way I can practice what I preach about confirmation bias.
So we're also getting a lot of questions about how to handle being asked about our opinion of another evaluator's work when we're on the stand. How do we deal with that? And then someone else said also, what about being hired as an expert to comment on potential errors in data collection or data analysis of another expert? What are some issues to be aware of in this circumstance?
In the latter, I think that is the very definition of a consultant. If that's why you were hired, to help that side win by identifying flaws and vulnerabilities, I don't think you're an expert. I think you're a consultant. By expert, I mean the traditional, you evaluate somebody, you write a report, maybe you testify on it. Those are the roles that I'm making distinct. Again, I think if you've done a careful job with setting the role expectations up front with the person who's going to be doing direct examination with you, hopefully that person is not going to be trying to coax a consultant level opinion out of you. One of my colleagues was once asked by a judge to specifically identify the faults in another expert's, it was a contested hearing, was asked by the judge to explicitly identify the faults in somebody else's opinion. Again, that's the most awkward of awkward situations where the person with the most authority is expecting you to do something. And I think the best we can do in that situation, again, is you've got to make that decision. How far am I willing to go? But I think I would certainly begin by saying, you know, Dr. So-and-so would have to speak for what she or he did in this case. Yes, there are some differences, and I'll be happy to talk about why I came to the conclusions that I did that are different than the way Dr. X did. So I'm trying to draw attention back to what I evaluated, because my job, unless the judge is going to force me to do it, in my opinion, is not to try and tear down somebody else. My job in that moment is to explain and advocate for the data that I gathered.
Okay, the next question is there any empirical research that supports the conclusion that there's a negative and risky role conflict that occurs when trial consultants testify as an expert?
Not that I'm aware of. There may be some out there, but I'm not aware of it. For me, I think it just raises the ethical question about a possible multiple relationship that might impair objectivity. When I'm in the expert role, I'm striving to be objective. It's hard for me to do that if I'm also partisan, if I'm trying to help one side or the other win. I try and keep my momentum focused on advocating for the data that I gathered and what they mean. But if there is some literature out there, I'd love to know about it.
Can you elaborate on reasons why you don't recommend commenting on another expert's report? If you're advocating for your conclusions as a testifying expert, what's wrong with clarifying why you disagree with an opposing expert's conclusions?
I think it's fine to disagree and explain why, because then I'm talking about my data. And that's what I'm there for. I'm not going to ever say, I hope, well, Dr. So-and-so really did a substandard job on this. This test is not empirically supported. I just try and stay away from anything that's going to be critical of another expert. Again, because I think it puts me on a gradient of winning rather than being objective.
So for those of you that need to jump off, it is 1 o'clock. Dr. Kukor, are you okay with answering a few more questions, or do you need Rachel, did you?
Julie, I was just going to make a couple of comments. So it sounds like some people are having issues with the link. I've been able to access it and get through the questions myself. So I'm not really sure what the issue that, I don't know why people are experiencing difficulty, but what you can do is you can always save the link and just try again later in a couple of hours or later tomorrow. It's open for 48 hours. And if you're not able to access for some reason, you can always just email me and we will definitely get you what you need. So don't panic.
Thanks, Rachel. Next question is, I find the suggestion of including a section in competency to stand trial evaluations addressing data that may not be consistent with your opinion to be interesting. How do you address the counter argument that this may introduce ammo for poking holes in your report that may not otherwise arise? I think in doing these evals, we're trying to assume all possible counter arguments may arise anyway in preparation, but I'm just wondering more about this.
Yeah, I get asked about this a lot. Somebody told me once, when somebody's pointing a gun at you, the last thing you should do is put bullets in it. And I get that concept. My experience is it's just not true in this context. I believe if you're going to undergo cross-examination, you're probably going to hear a lot of those questions anyway. And if you identify maybe shaky assumptions or alternative ways to view the data, you are essentially exerting control over the data that you have. You're saying, yeah, here are the things that may not support my opinion. And again, you know, on a really messy case, there might be a lot of data points on the other side. We do not have to meet a standard of 100% of our data landing on one side or the other to land with confidence on a conclusion. I believe that when we explicitly do this, which is exactly what the specialty guidelines tell us we ought to be doing, we are conveying to the court that we are scientists, that we are trying to be objective, and we are identifying, weighing, and even considering the data that don't support our conclusion. That's important because I believe, and I didn't always think this way, but I believe now that if we don't do that, it looks like we're cherry picking. Cherry picking is a euphemistic way for saying indulging in confirmation bias. So the best I think, remedy, at least as I'm thinking about it today, for that particular brand of confirmation bias is to explicitly identify those data points and then describe why you did not find them persuasive.
I know this question may be meant to be a little bit funny, but I actually think there's a lot of merit in it too. How does your awareness of all the potential biases and reasoning errors not incapacitate you or end up taking you endless hours in your work?
That is funny. Well, I think I try and focus on a couple, and I think the best way to, one, if we just all assume that confirmation bias is the biggest threat, we're going to deal with that. If you really want to identify ways in which you've been biased, look at reports that you wrote a couple of years ago. We tend to think about these things more objectively than we do the report we're working on now. I'm always on the lookout for confirmation bias. But of the, and I don't know, there was something that appeared in, and I think, unfortunately, the source was Wikipedia that listed hundreds of potential biases. Of course, that's far too much for any one of us to consider. And I don't think about them all the time. Maybe it's a defendant that I just find myself disliking. Now I've got to worry about a visceral bias. Plenty of defendants don't have that effect on me. It might be somebody that I feel sympathetic for. Again, I've got to deal with a visceral bias. But if I don't notice those tugs, then I'm not so worried about visceral bias, and I'm more inclined to focus on confirmation bias.
So we hear a lot in our trainings about cultural issues that are involved with the testing that we're using. But how do we address other biases or biases in general with things like the MMPI or PAI, HCR20, different competency instruments, malingering tests, et cetera?
Well, certainly you've got to be sensitive to whether somebody, the group in which somebody belongs is represented in the normative population associated with the test, the population that the test was normed on. I can think of a case that I had some time ago where somebody was in the United States illegally and had grown up in the jungles of Peru. It was hard to find somebody that could speak his language, and his attorney had questions about his cognitive functioning. Can you find me a test that was normed, an intelligence test that was normed on somebody like that? I don't think so. Sometimes we struggle to do the best we can. And in a situation like that, I think, wow, you better have a good reason for using a test if somebody is not representative in the population that it was normed on, because I think you're going to have trouble correctly interpreting it. So that's one thing. We could spend hours talking about all the ways that cultural biases, I think, enter into our work. I think many of them boil down to a single discriminatory kind of way of thinking, that we think because the person is part of this group that they share all the attributes that I think are true about people in that group. That is in essence what we mean by discrimination. And again, I think if you find yourself thinking about, again, trait-based explanations, even if they're culturally mediated trait-based ones, it's a good idea to slow down and to run that case by somebody else, somebody who might think about things differently than you do.
Keith Stanovich, who authored How to Think Straight About Psychology, touched on some of the points you adumbrated. Could you comment on essentialism versus operationalism and how this impacts on falsifiability? Although I don't think you employed the term.
Wow, I wish I understood that question. I do not. There's some $20 words in there for sure. If whoever asked that question can put it in terms simple enough for a guy like me to understand, I'll try to answer it, but I'm just not sure what's being asked there.
Okay, another one is, how do you handle cases or evaluations that go across long periods of time? Cases that the attorneys don't take to trial or you reevaluate after a length of time?
Oh, excellent question. It is a vexing problem if you're doing a competency evaluation, competency to stand trial that is focused on present mental condition. How, what's the expiration date on a competency evaluation? Is it 2 weeks or 3 weeks? Probably not. How about 6 months to a year? How much confidence do you have that what you saw 6, 8, 10, 12 months ago is accurately reflective of the person's current mental condition? These things are undefined, and they are vexing for us because we have decisions to make about when, if you reach that expiration point on data. None of us would think about coming home from a 2-week vacation and opening up the fridge, grabbing a carton of milk and slamming it down because we're thirsty. Milk expires after a while. Same thing is true for our test data. Unfortunately, we don't have any precise way to know how long it's accurate. But we ought to be thinking about it. I have said before that I don't know what the person's current mental condition is. Here's what I saw at the time, but I don't know if it is still applicable to the person. So, when I talked about, I identified in one of the slides, humility failure. I think the word humble comes from the Latin word humilis, which means low. And I think it's important that we stay low. In other words, beneath the level of confidence that we have in the data, to not exceed the data that we have. If I'm going to try and testify about somebody's current mental condition and I saw them a year ago, I think I have exceeded that limit and I am not being humble about it. I much prefer to say, I don't know what this person's current mental condition is. I can explain what I saw at the time and not much more than that.
All right, I think we've got time for one more. I know your advice is to generally avoid commenting on others' reports, but if you summarize others' reports in your report, how do you avoid pointing out egregious errors or lack of data to support an opinion?
Well, again, I certainly wouldn't point out something as egregious. I'm trying to simply be descriptive. I might say, Dr. So-and-so thought this. I think this. I differ from Dr. So-and-so on these 2 points. And here's why I came to the opinions, the inferences, the conclusions that I did. And again, my focus is to turn the attention back to my data rather than criticizing another expert's opinion, either in my report or on the stand. It's an excellent point, I think, that we have to be mindful about. What if I think certain negative thoughts about the first opinion? How am I going to keep that out of what I think is a concrete descriptive approach to describing that person's result in my report? Anytime I've got doubts about that, I do not hesitate to ask one of my excellent colleagues at Netcare in Columbus to take a look at my report and see if what I'm reporting is fair and descriptive versus something other than that.
Thank you so much. That was fantastic. We're super grateful again for your time. And I believe we have your permission to send the slides out. Is that correct?
Absolutely. And my email address is on the title slide. I always enjoy hearing from people that have attended workshops or webinars that I've taught. So if you do have something that you want to follow up with me on, it's tkukor@gmail.com.
Fantastic. Thanks again. All of you that are still on, we'll stay on for a few more minutes so you can copy that CEU link. Otherwise, we will see you all next week. Thanks again.
Thank you, Julie.
All right, bye-bye.
Hey, Rachel, about how much longer you think? Oh, you're on mute.
Good.